Afternoon and thanks for keeping a date with me on this week's edition of Impact, reaching you live on ITV. I'm your anchor, Francisca Oga. Remember, on Impact we have just one object, and that is to turn Nigeria into shape. Now, let me first of all say congratulations to all Nigerians out there. It's a very happy 59th anniversary to you, even though some Nigerians took to social handles to say that they are not celebrating, that there's nothing to celebrate. Hey guys, I think the mere reason that you are a Nigerian and you're working free on Nigerian soil is enough reason to celebrate. Just take a look at what happened a few weeks back in South Africa, where our Nigerians out there were harassed, some were beaten, some lost their businesses just because they were on foreign soil. And here you are, every day you wake up, nobody is after you for any reason, and you think you don't have a reason to celebrate. I think what we should rather do is to come together, sit down and think of how we can move Nigeria beyond where we are, so that by the time we celebrate 60 next year, we will have cause to know that we've done better than we have been. And that is why today on the program, we will be looking at a very important aspect of our lives as Nigerians, and that is health care. Health, let's say, is wealth. You know, if we're not healthy, we're not going to be talking about anniversaries at all. And today on the program, I'm going to have with me two medical personnel. We're going to be looking at the healthcare system in Nigeria. When you walk into the hospital, either as a patient or probably you took a patient there, or even when visiting a patient, what vibes do you get? How do you feel? Do you think that the best is being done? Do you begin to get the impression that, oh, well, they're just here because I don't have enough money to take them out of Nigeria? Do you get the impression that if they were in India or some other place, probably they would be getting superior health care to what they are getting here in Nigeria? Why is this so? Why do we have a lot of people leaving Nigeria for other countries for healthcare reasons? And even our medical doctors, on a daily basis, we hear of people who have left Nigeria, having completed their medical training. They go out of the country to find, let me call it, greener pastures. Why is all of this happening? So today we'll be discussing healthcare as it revolves around patient-centered care. Should it be all about the patient, or should it be all about the money, or about some other thing? That is what we'll talk about on the program today. But before then, let's just look at a few things that have happened in the days before the program. To start with, the long-awaited visit of our president to South Africa has finally taken place. President Buhari had actually gone to South Africa to meet with his counterpart Ramaphosa to talk about the welfare of Nigerians living in South Africa. Even though some of us have been of the opinion that, hey, everybody should just come home. We all know that the world is a global village at the moment, and you cannot run away from the fact that at one point or the other, you might need to travel, you might need to visit. So the answer doesn't lie in running back home, but in doing what he has done now, to go and dialogue, and let's see how they can find common grounds for Nigerians to go to South Africa peacefully and come back, to even stay there, transact business the way we have South Africans doing in Nigeria. We'll be filling in on the details of their discussions as the days go by. But one of the things that the president said to Nigerians out there is, be law abiding. It is not an excuse because we are a Nigerian to go to somebody's country and misbehave. Be law abiding. Be on the right side of the law, and then we'll know what to do when the time comes to fight for you. Also, the medium-term expenditure framework from 2020 to 2022 has been approved by the National Assembly, and of course by Tuesday we'll be expecting the budget to be presented to the National Assembly. Let's see how we fare this time in terms of capital projects. It has been said over and over on this program that we will do ourselves a lot of good if we put more money into our capital projects and less into recurrent expenditure, because one brings nothing back and the other means growth and development. Let me not bore you with plenty economic details. We'll bring that to you as the weeks go by. We'll take a break now. When we're back, we're going to center fully on patient-centered care in Nigeria. You don't want to miss any of this. Just stay right now.
Have you been thinking of how to get your goods and services or events advertised at affordable rates? Think no more. ITV Abuja, located in Mpape, is poised to serve you better. For advert placements and inquiries, visit ITV Mpape Abuja or call 0706 715 7865, 0803 775 5024, or 0803 539-7151. Independent television, certainly the best.
You're still watching Impact, reaching you live on ITV. I informed you before the break that our focus today is on patient-centered care. Should Nigerian healthcare delivery be about the patient or about who or what? To run the program to talk about this, I have with me in the house a consultant neurosurgeon. He asked me not to call him doctor, so he's Douglas Okor. You're welcome on the program.
Thank you very much, Francisca, for having me once again.
And happily, I have somebody who permitted me to call him doctor. So we have Dr. Roland Aigbovo. I hope I got that pronunciation right. He is the president of Association of Resident Doctors in the FCTA. You're welcome on the program.
Thank you very much.
Okay.
Nice to have me here.
My pleasure, absolutely. So before we delve into all of this, let's look at the present health indices in Nigeria. What does it look like to you, Douglas?
I think basically you talked about we are 59 years old, and you talked about moving Nigeria forward. I think healthcare basically it's fundamental when you look at economic development. And of course, I don't need to bore anybody. When we talk about the healthcare indices in Nigeria, we are struggling as a date. In fact, usually when it comes to these 1st of October dates, the first thing that comes to my head when I think about Nigeria with respect to healthcare and probably other developmental sectors is Agbaya, which is a Yoruba word for your old.
Overgrown baby.
Yeah, exactly, overgrown baby. So we are struggling definitely when it comes to looking at the healthcare indices in Nigeria.
Okay, so Dr. Roland, is that your take too? Do you
Yeah, I want to agree with him because in Nigeria, has been all talk and no action. Every now and then we hear we want to do this, we want to do that, and at the end of the day, nothing physical is being done other than all talk. So that's the situation in our country at the moment.
Okay. Now let's look at certain things within the purview of those who actually deliver healthcare in Nigeria. We've had some tussles in the past because they say a house divided against itself, of course, might not stand. Let me not say will not stand. This one has been standing. So we've had interprofessional disputes within the medical field. How does it stand now?
I think basically, Francisca, we still have major issues with that. I think what we are looking forward to, and that's why one of the things we would like to talk about is what we call the second National Health Summit of the Nigerian Medical Association. And I want to say big up to the Nigerian Medical Association for actually putting forward this summit, because some of the key things that are going to be discussed and key in terms of looking at strategies, in terms of looking at advocacy, as one of the things we're actually putting out now. For example, the indices, the Nigerian healthcare indices. Second thing that they critically want to talk about is actually the interprofessional relationship between different healthcare providers. Okay? And the reason why we're looking at some of these sub-themes is we want to talk about patient-centered care. Okay, what are the things, what are the fundamentals, the foundations that we need to create to be able to deliver this patient-centered care? I'm sure we'll talk about that later. But in terms of interprofessional relationships, we are still struggling, especially within the public health sector in Nigeria. Okay, usually you don't have this kind of squabbles between either the doctors, medical lab scientists, physiotherapists, nurses, pharmacists. Usually you don't have those issues in the private healthcare space in Nigeria. But when you look at the public sector, you actually have most of those issues. And it's mainly because they are not established clinical governance systems, sort of corporate governance systems within healthcare, where everybody knows their role. For example, everybody knows their job description. And you start looking at things like what we call clinical and management strategies to actually separate clinical and management, or find out where these are domiciled. For example, my thinking is that if you look at the medical lab scientists, for example, okay, they should have what we call managerial leadership within their domain. But for clinical leadership, or the keyword is responsibility, for clinical responsibility, they must be responsible to the pathologists who are doctors. Okay. But for managerial responsibility, they should be responsible for themselves. So it's trying to actually create such, in terms of looking at the institutions and the organizations, start creating a better organizational structure that will help with some of these things. I think What we are hoping is that we have discussions, robust discussions and deliberations around things like interprofessional relationships, so that we can start moving towards teamwork. Because, like I said, patient-centered care is about focusing on the patient. Because, like I always say, the Nigerian patients are worth it.
Okay. Now, Dr. Roland, for instance, I work in the media. Now, I met some cameramen on ground. They are cameramen and they've been in the profession for 30-something years before I joined, but I am a trained producer. And when we go on the field, some of the things we're told in the classroom, in the textbooks, do not really pan out as clearly as possible. They, having been in the field by virtue of experience, might have some of the answers to this. Does this have anything to do with the fact that some people who are probably nurses, lab technicians, are thinking that having spent a whole number of years out there, they should know more than maybe medical doctors actually who probably have spent less years in the profession? What I'm saying in essence is, should experience count in this organizational structure we are talking about?
Yeah, experience do count in the structure that you've just figured out now. But the truth of the matter is that, if I want to also borrow the words of Douglas, managerial and clinical. Now, if you're dealing about, well, the one that easily come to mind is the issue of lab scientists. You know, once it comes to their domain, having to do with laboratory investigations and all those stuff, yes, experience counts and all. But when it comes to taking a decision,
which is clinical accountability. Clinical accountability.
You understand? When it comes to taking a decision, they are the ones to run the investigations, to say, okay, this is our findings. The doctor is responsibility now is to marry the findings with the symptoms of the patients, to say, okay, most likely this is what it is. Yeah, experience counts, but when it comes to taking that decision, that clinical decision, experience doesn't count. If you are not a clinician or a doctor, you cannot take that decision. It's just going to be more guesswork. Okay, I've seen so many things like this, it's more likely to be like this. That's guesswork. Okay. But when it comes to taking the right decision, like, okay, this, because there are so many diseases that my presenters see they are saying, just one thing will differentiate one from the other. Okay. So that is where it has to come. Yes, experience counts when it comes to their managerial, their domain. But when it comes to taking that clinical decision, a doctor is trained to take that decision. They are trained to carry out those investigations.
I think the two key things are clinical accountability and managerial accountability. Those are the two things. So from the managerial accountability, for example, I do not see why a medical lab scientist wants to go on leave and they should be pandering to the pathologist to do that. They can sort that out within themselves. When it comes to their training needs and stuff like that, within themselves they can sort that out. But when it comes to clinical accountability or making the final decision regarding the patient's care and stuff like that, they must pander and look up to the clinicians who are the pathologists. And so that's where you differentiate clinical accountability from managerial accountability. And we are hoping that in the future, these are the things that, like I said, in the second National Health Summit that's coming up in November, 4th to 8th of November, that those are some of the key things that we're going to be discussing about. Okay. You know, and I think that's really critical. And like I say, I'm really, really proud of the Nigerian Medical Association that they're actually putting their foot forward. And one of the key things that they're doing is that they are actually standing in and fronting for the Nigerian patients. Okay. They're actually promoting that we should focus on the Nigerian patients. That in fact, one of the key things, one of the key, like I said, sub themes in the National Health Summit is about these interprofessional relationships, because they want to actually solidify these relationships. Because once you can actually start having different healthcare professionals working together for the Nigerian patients, you know, so that's where we need to go.
Okay.
And just also add to that, sorry. You know, another thing is also that when you have put in the hands of affairs, you also shoulder the responsibility that goes with it. In running those investigations, if anything goes wrong, the person that's going to go in for it is the doctor. Okay. And that's why it's very important that the doctor takes that decision, because that is his responsibility. If anything goes, if you run an investigation for any patient now, and the doctor now goes ahead to maybe write, or the lab scientist wrote to say, okay, this is this, and the treatment goes that way, the doctor takes the fall if it's a wrong diagnosis, not the lab scientist. Okay. You understand? So many times they shy away from this. All the medical litigations and negligence and all those stuff, most times it's the doctor that is asked, because he is supposed to take responsibility.
He's taking the final clinical responsibility. Clinical responsibility.
Okay. Now, let's talk about customer care, because we're talking about patients. They are like customers now. Okay. Now, most times in Nigeria, especially in the public hospitals, patients go home with a sour taste in the mouth. It begins from the reception. The way you are even received when you want to buy your card, you are extremely sick probably. The fact that one is on his feet and walking doesn't mean that the person is feeling good, you know. You're shoved about, you're made to wait in long queues, the protocols could just kill you before the disease and all of that. I mean, in all of this, what do you as medical doctors do for the patient to ameliorate this suffering simply because you went to the hospital and
okay, so Francisca, you've talked about the medical doctor. So I'll say two things now, since you brought the medical doctor. Even though somehow, when you look at Nigeria, when you look at the issues of political leadership, the issue of administrative leadership and clinical leadership, it's been sort of the doctors. Political leadership means Minister for Health or Commissioner for Health. Okay. Administrative leadership means the medical director, the chief medical director, and of course clinical leadership means the consultant or the doctor looking after the patient. Even though the doctors have run these things, healthcare is not just about doctors. Please let's establish that very, very clearly. Healthcare is about systems. That's number one. Number two, we are in Nigeria, Francisca. Okay, so that means that if you go into the Ministry of Health, go into the Ministry of Finance and stuff like that, what kind of customer service do you receive in those places? In your MDAs, your ministries, departments and agencies, what kind of response in terms of customer service do you believe you receive in those places? Now, if you're thinking that because healthcare is about human beings, you're going to receive something different, then that's a big joke. Okay.
So then, where does this Hippocratic oath you people take comes in here? You took an oath.
No, I agree. I agree. But what I'm just trying to say, Francis, I'm trying to bring out the realities.
Because at the Ministry of Finance, there's no life-threatening situation happening.
True. That's why it's painful. All I'm trying to say is that the healthcare professionals in the healthcare institution in Nigeria, especially public healthcare institution in Nigeria, they are Nigerians. That's what I'm saying. They are Nigerians within the Nigerian space, within the Nigerian institutions, and within the Nigerian system. And so they will behave like Nigerians. Okay? Now, does that mean that we are doomed? No, it doesn't mean. It just means that we need a revolution. And that's why it's good that, again, Nigerian Medical Association, big up to you guys, because you guys are talking about patient-centered care. So if you talk about customer service, you're actually talking about patient-centered care. So what is this patient-centered care? What is patient-centered care all about? Patient-centered care is the kind of care that is meaningful and valuable to the individual patient. It's like a new movement in the last 10 years or so, okay, especially in developed economies. I didn't say developed countries, I said developed economies. There's a difference. So especially in developed economies, there's a new move to actually try and empower patients and by extension their relatives for them to actually get really, really involved in actually making decisions or taking action plans with respect to their care. Okay? Now, there are different pillars of this. And it is pursuing those pillars and creating strategies and creating platforms and a foundation for those sort of pillars to actually work on that will actually start walking the walk on that journey to actually start changing things little by little. And what are these pillars or these principles? Number one is respect for the patient's individuality or autonomy. That's number one. So for you're looking at patient's values, patient's preference, patient's needs, and stuff like that. Secondly, we talk about the issue of integration and coordination of services. In Nigeria, one of the major problems we have is that things are fragmented. The federal government is doing its own thing, the state government is doing its own, private people are doing their own, local government is doing their own, and of course, who suffers? The patient suffers, and suffers significantly.
Definitely.
Okay? Of course, we look at things like information and education. Taking patients and their families through what the diagnosis is, what it actually means, what kind of treatment strategies there are, options, what they're going to do when you discharge them and all that. Of course, patient comfort is absolutely important as well. Under patient comfort, you look at things like pain management. We look at things like the ability for patients to actually do their activities of daily living. We look at things like environment of the hospital or wherever they are looking, their surroundings where you're looking after them. We also look at things like emotional support.
Definitely.
Emotional support. By the time someone has a really bad diagnosis, cancer, this and stuff like that, emotional support to alleviate their fears and their anxieties. Of course, key issues like the involving families and friends as well in the care of the patient, making sure they are part of it, that decision making, making sure that they are supporting the patient and stuff like that. Okay. Of course, you look at issues of continuity of care. A patient is being discharged from hospital. What's happening next to the patient? Where is the patient being taken to? And of course, access as well. And of course, if you talk of access and you look at one of the sub-themes of the second National Health Summit, we are talking about universal health coverage.
I was going to get to that, don't worry. We'll touch that right after now. So now let me get to you, Dr. Roland.
If I really just say something about the Hippocratic Oath, every now and then we are being
Blackmailed.
Yeah, that's the right word. You got the right word. We have been blackmailed with this issue of Hippocratic Oath. But one thing you should understand that most of the oaths that we see these days is actually the abridged version. The real version of that oath says that the doctor is supposed to do all this when the environment to get to do all this is made available for him.
Absolutely.
Or for the doctor. So most times, because that is not included, and let me also remind you, even the physician's oath now, it's put there now that we have to take care of ourselves first before taking care of someone else.
Well, we like that.
Yeah, then sorry, let me also go to the issue of reception. Yeah, let me also go to the issue of reception. You know, why we have so much issues with patients' satisfaction in public hospital. I can speak very well public hospital because I work in a public hospital.
Okay.
You know, an average Nigerian, just like we know, is sizable close to 70% of Nigerians are living below poverty line, even 80 or thereabout, which means there is a high, how would I call it? People tend to go to public hospitals more, and the population of people coming to public hospitals are high. Now, most of the staffs, right from the reception down to seeing the doctor and everything, and so most times the crowd that you have to manage, and you and I know that managing human beings alone is hold-on. No matter how corporate that organization is, managing human beings is cumbersome. And so not everybody have that temperament to actually handle some of those services. And if you don't know if the person can handle and you employ the person to do that work, of course, results you're going to get is different. If I'm a very welcoming person and you come to my institution, oh, how are you? How may I help you? And all those stuff. The need, as in the healing might just start from the very first person you are meeting.
Definitely.
But if you meet somebody that is, maybe the person is so exhausted and maybe had an issue at home or personal issue to deal with, the first thing the person going to maybe one little thing will spark the person up and one person takes it on that lane. Now, at that point in time, you're already feeling dissatisfied. No matter even if they saw the best specialist in a particular condition I brought you, you will not be satisfied based on that particular. So the point I'm trying to make is that there is a lack of motivation in the workforce for so many reasons, even living in this country. And the issues are very, very glaring, and they are real. And that's why the difference in public and private hospitals are different.
Now, let me agree absolutely with you and tell you a situation, a personal situation.
Yeah.
I have never used my NHIS provider. Why? I was pregnant, my husband insisted, go there, a very big public hospital in Abuja. I wouldn't mention their name so that it doesn't seem like I'm blacklisting them, for the benefit of all those who need to go there.
Oh, yeah.
Now, I turned up, you know what a pregnant woman is like, at about 4 or 5 weeks, all the hormones raging, got to the hospital. Lucky me, there was absolutely no crowd. So there's no excuse of saying there were 1,000 people to deal with. I greeted good morning and got no response. The nurse was writing. And I said good morning again, thinking she didn't hear me, and the nurse was still writing. So I increased my volume and now said good morning, and she flared up. Oh my God, that I have scattered the calculation she was doing, that she was adding figures, that now she has to start afresh, and she was screaming and screaming, and I just didn't know what to do. And other people who heard her screaming, other nurses from maybe ran in to ask what is the problem. And to her, it was a good enough excuse that you were adding figures that I was not seeing because your paper is before you. I'm at the other end of the desk. I have absolutely no idea what you were doing. All I saw is a person being greeted and not even acknowledging, which of course, under normal circumstances, you should stop what you're doing, attend to me and get back to what you are doing. But she kept on and on and on, and at a point I told them, never mind.
So you
I left there, I went for a scan, at least to be sure that my baby was fine, and went home. I never looked back. I have never gone back there. I'm talking about 12 years ago. I've never taken any of my kids there. The money that's been deducted from my husband's salary just goes. I go where I'll be treated like a human being.
So Francisca, it's very clear that that nurse doesn't understand patient-centered care, isn't it? So you can see why the advocacy, this advocacy for patient-centered care by the Nigerian Medical Association is absolutely critical at this moment.
Very important.
You know, so we are in a defining moment in the history of our country. And I think I'm really proud of the Nigerian Medical Association. You know, that for the first time, they are putting the Nigerian patient first.
Definitely.
You understand? They're putting Nigerian patients and saying, hey, let's come to the table. You understand? Bring all the key stakeholders, all the key players within the Nigerian healthcare ecosystem. Let's have discussions about the critical and fundamental issues, the platforms that we can actually ride on to actually start taking us slowly, because it's going to be a long ride.
Definitely.
It's going to be. We are not going to get out of it. We know what the issues are. Well, Roland was trying to talk about the realities in our public sector. Those are the realities, yes. But I'm so glad that things can change. The only constant thing in this world is change. And so we are hoping that by the time we pull all these stakeholders together, by the time we start advocating, lobbying, that slowly, we can start at least galvanizing the people, the Minister for Health, the Commissioners for Health, galvanizing them to actually start taking some strides and be bold enough and show some courage to start actually making some decisions that can start changing the face of healthcare in Nigeria. Because the Nigerian patients are worth it.
Okay. So you're watching the program Impact reaching you live on ITV. In fact, we have been talking about you and I. That is because the Nigerian healthcare system is ultimately going to cater for you and I. So if it becomes what it should be, we both will be happy at the end of the day. We're going to take a break here. We'll be back shortly and this discussion continues. Of course, I'll throw open the phone lines when we're back from the break after some discussions so that you too can put it to them. Let's be lawyers since you are doctors. You can now put it to them what you think about the Nigerian healthcare system. Stay tuned.
Have you been thinking of how to get your goods and services or events advertised at affordable rates? Think no more. ITV Abuja, located in Mpape, is poised to serve you better. For advert placements and inquiries, visit ITV Mpape Abuja or call 0706 715 7865, 0803 775 5024, or 0803 539 7151. Independent television, certainly the best.
I just want your papers, please.
Sir.
Salary don't enter. Eh? Yes, so. And month I never even reach them. My salary plenty, oh. No wonder I no gree collect roja from my hand. Shut up, sir. I'm here to bail my younger brother. happen.
With good laws,
proper funding,
training, and cooperation.
If it happen.
ITV News Bulletins are comprehensive packages. Our team of reporters is passionate and dedicated to make sure you know.
Behind me is the bus-carrying presidential aspirants, as well as other party leaders.
Clearly shows that workers in this arm of government are in total support of the directive.
In the views of government officials from Nigeria, the caution on the lips of many is for Nigerian government to ensure that China indeed gives quality for service. From Beijing, I'm Miharo Atta, ITV News, China.
ITV News, guided by core principles of objectivity, fairness, and balance.
Let me sincerely apologize for that break in transmission. Of course, it's due to technical hitches. Now, before that break, we were talking about the medical system in Nigeria. We're talking about patient-centered care. And of course, this is derived from the theme of the NMA Summit for 2019. And we have people in the house here. Of course, Dr. Douglas says he's not doctor. In any case, he's a consultant neurosurgeon. How come he's not a doctor? I don't know. And I equally have in the house Dr.
You want us to take like 20 minutes for me to explain that?
And I equally have Dr. Roland in the house. They have been shedding more light on how we could make our patient care system more centered around the patient. But maybe we need to talk a little about the summit also, so that for what we cannot discuss here, you could actually get to go to the summit and then get more details on that. So this all-important NMA summit that's going to bring things down home to the patient, when is it actually coming up?
Okay. First and foremost, this is actually the second National Health Summit organized by the Nigerian Medical Association. It's happening from the 4th to 8th of November 2019 at the International Conference Center here in Abuja. And also, alongside the Health Summit, it's going to be hosting the Commonwealth Medical, the 25th Commonwealth Medical Association Triennial Conference. So it's going to be running side by side with the National Health Summit, the same venue as in the 4th to 8th. Well, the first National Health Summit of the NMA held in 2013, 28th to 27th of January 2013 in Asaba. And it was a week-long activity where so many
Discussions were held,
and a fallout of that first National Health Summit was actually the National Health Act and also the Basic Health Care Provision Fund. Was actually a fallout from that National Health Summit of that. And also for NMA, that was where we developed the strategic plan for the Nigerian Medical Association. So the recent one is from 2017 to 2022. So that Health Summit also gave us a whole lot of ideas and information, strategies on how to actually move both the Nigerian Medical Association and even the healthcare system in Nigeria forward. And that's why we chose the theme for this second National Health Summit, the patient-centered care. Before now, though we as doctors, we do want to fight for our right, but then every now and then we see us as being selfish, that's the word. That is only what concerns us that we are always pushing for and all this stuff. We want to change the narrative.
Yes,
that now let's put
from that.
the patient first, because we all are working because of the patient. Because if there's no patient, we can't treat ourselves.
Besides, all of us are potential patients.
Yes.
Everybody.
We are all human.
Patients.
And so we can be here today and the other time can be a patient. Yeah, that's the truth. So, and that's why the National Health Summit will actually propagate and so telling people that this health summit is not all about doctors. It's about the health system of Nigeria and how to do things right. Yeah, you talked about the issue of medical tourism, people going to India and all those stuff. Yeah, a whole lot of reasons is responsible for that. But rather than we focusing on the problem, the issues of medical tourism, why not focus on what led to that medical tourism in the first place?
And start solving them.
And start solving
them.
Slowly. You understand? It's not going to be an automatic turnaround, but let's start the process. Because if we keep talking about, oh, doctors are leaving, they're in droves, patients are leaving to other countries, if we keep wailing and whining about this thing, it will never change anything. Now, let's come together. Let's begin to discuss how did we get to this place? How do we reverse it? Because whether we like it or not, Nigeria is our own. And every bit of our existence, we have to be responsible for it. If we are good today, it's going to be Nigerians that made it happen. If we are not, it's also Nigerians that made it happen. Okay. So the reason for this second National Health Summit now is for us to come together. Let's sit down and discuss how to move the healthcare system and even the healthcare industry in Nigeria forward. Because it's a whole lot of, I would call it, a whole lot of untapped resources, even in the healthcare industry alone in Nigeria. A very, very wide range of untapped resources in this country. Because we have the manpower, now we need to develop the infrastructure. It's not all about, oh, we have 10,000 consultants in neurosurgery, like my neurosurgeon here, or we have 15,000 cardiologists and all those stuff. Many of them, of course, you know, medicine is evolving. Sure. If you say I'm a cardiologist now, another person will ask you, what kind of cardiologist? Are you an interventional cardiologist or a radiologist? No, there are a whole lot of empowerment, involvement, even in the medical practice, and we need to move with this. Now, I'm going to be talking about interprofessional rivalry. We're going to talk relationship. I'm going to talk about brain gain and brain drain. I'm going to be talking about universal health coverage. We're going to talk about medical education, both at the undergraduate and postgraduate level. A whole lot. I'm going to sit down and discuss, because I believe that when you inculcate some habits into any individual at a very, very young age, he's bound to grow with it, rather than try to change someone when he has gotten to a particular age. Okay. So that's the whole idea about it.
So at 59, do you really think we can change, we can grow?
The only constant thing in this world, Rebecca, Francisca, is actually change, and we can change. Definitely, absolutely. I have no doubt about it at all. And I think, once again, I'll say big up to the Nigerian Medical Association, because them actually putting their leg forward and actually creating such a platform, you know, to advocate for the Nigerian patients and look at some of the key issues, in looking at the sub-teams, looking at things like you rightly said, universal health coverage, looking at brain drain and brain gain, looking at things like reversing medical tourism, because we actually do have the capacity to reverse medical tourism and get to a point where patients are coming from other West African countries and from Central African countries into Nigeria. But what we need to do is walk the walk, talk the talk, and actually create fundamental platforms where we can actually start getting confidence from Nigerians, first of all. Because if you don't get confidence from Nigerians, first of all, you can't pull other people into Nigeria. Absolutely, Francisca. Absolutely. Yeah. So I think the second National Health Summit is definitely the way to go. A big thumbs up for the Nigerian Medical Association for creating this platform. And one of the things that the leadership within the Nigerian Medical Association is doing that makes me so proud of them is that they are reaching out to other healthcare professionals. They're reaching out to the body of nurses and midwives, the body of pharmacists, the body of medical labs, and saying, hey, come. Let all of us come together and sit down and have a discussion, have deliberations on how we can advocate and pull in all the key stakeholders, the president of the country, the minister for health, and all these people, pull them into one place, okay? And actually get something out of that we can say, oh, this is some sort of policy advice or some sort of guidance or something that we can actually use to actually move things forward. So, Nigerian Medical Association, Tuale.
Yeah, okay, so who's invited to this summit? Let's know. Is it the patients that, can they come and really tell you people how bad they felt over the years? Who do you want to come?
The summit is actually open to everybody. It's not restricted to healthcare professionals because we can learn a whole lot from others. As a doctor, I might not be able to tell how a patient feels because whatever information I'm going to give might be biased. I want to say it to suit my... Let others come, the public, say your own experience in any of the Nigerian hospitals or what you think. Because the fact that we are doctors doesn't mean that we know it all. Or the fact that we are healthcare professionals doesn't mean we know it all. There are some things that we can also learn from others. So it's open to everybody. And the special guest of honor is going to be the President of the Federal Republic of Nigeria, President Muhammadu Buhari. The chief host is the Honorable Minister of Health of the FCT because it's happening in FCT here. Then the Minister of Health and Minister of State for Health is going to be there. And also, I also mentioned that we're going to be hosting the 25th Commonwealth Medical Association Triennial Conference. And the President of the Commonwealth today, Duzayaki, is going to be there as also the special guest of honor.
In fact, the Minister for Health in Dubai, United Arab Emirates is going to be giving
a presentation too.
Okay. All right, if you saw the phone number that has been on the screen before now, that number is for you to ask about the summit. Maybe you want to attend the summit. Maybe you have questions about what's going to happen at the summit. In fact, in whatever way you want to be part of the summit or ask about the summit, the number you saw before on the screen is a number that you should call to get issues clarified concerning the second NMA summit. Luckily, it's holding in Abuja, the FCTA, the federal capital. So I think it's so centralized that anybody who has the welfare of the Nigerian patient at heart or anybody who is serious about medical practice should endeavor to be there to lend their voice to finding a solution to the kind of patient care we have right now. In fact, so many people are drinking herbs and supplements, not because they like them, but because they don't want to go to the hospitals and face some of the things they face there. I'm a living testimony, because I said that. Okay, so...
All right, sorry, if I may just say this, you know, the keynote speaker is the executive governor of Delta State. Okay. He's a medical doctor. He has been a lawmaker and presently the governor of Delta State. So no other person who I feel is most qualified to give that keynote speaker because as a legislator, he's a distinguished senator. Yeah? Once a senator, always a senator. So as a distinguished senator, he was the chairman of the Senate Committee on Health. And also he was instrumental to the implementation or the enactment of the National Health Act. So he's coming to discuss, to give the keynote lecture for the Health Summit, and as well as the Minister for Health of the United Arab Emirates, also coming to give his own perspective of how they were able to turn around the health system in UAE. So it's going to be a very enlightening summit. I know that.
So this is sounding so much about the patient, but I see somewhere here the sub-themes for the Commonwealth aspect of the program where it says physician well-being and autonomy in the Commonwealth, the role of CMA. Could you shed some light on that? Okay.
The Commonwealth Medical Association, like you know, is a medical association of Commonwealth states. And presently, Nigeria is a Nigerian is the second vice president of the Commonwealth Medical, superintendent over the West African region, who, by the grace of God, at this conference, he will be installed as the president, the first Nigerian to attend that position, the first president of the Commonwealth Medical Association. Now, the whole idea about that sub-team is the physician's role. The physician's role for them to like putting ourselves first to make sure we are doing well ourselves before even thinking about the patient. Because if, as the physician, you are not mentally, physically, spiritually, or even emotionally sound or fit, you cannot do well to give the best to any patient. So now, rather than we focusing on the patient now, or rather focusing on the patient, you need to look inward first. You need to focus on yourself. Make sure that you, as the physician, you are mentally and you are stable. Let me use that word. Because when you define health, the World Health Organization said it's not really the absence of infirmity or disease. Mentally, socially, physically, spiritually, emotionally, you have to be stable for you to actually
economically. Very crucial.
Well, we can do that.
We can add it for our own, actually.
Our own, economically.
Especially in this country at this particular point in time.
Economically, so that is actually why that sub-team. So we need to actually discuss how we should put ourselves first, take care of ourselves first before taking about the patient. And mind you, the rate of which doctors and healthcare professionals are dying these days is giving a whole lot of concern. We are getting lots of stories. Giving a whole lot of concern. The doctor will go do one thing, the next thing he slumps and dies and all those stuff. We had a shocker this year, July this year, where we're having a National Executive Council meeting of the Nigerian Association of Resident Doctors, where a NEC member sat down, just took a walk, in less than many seconds, fell and
passed out.
Even in the midst of doctors.
Can imagine.
So we have to also now put that in the forefront to actually discuss how we need to improve our health before thinking about offering the same help to patients.
Okay, as a patient, let me now equally speak for the doctors, especially in Cross River State. I happen to be conversant with that because I am from Cross River State. Over the past few months, I've had my classmates in Cross River State that are doctors send me reports of medical doctors that were kidnapped. In fact, it happened so many times that they had to down tools in Cross River to say, for each time you kidnap a medical doctor, we will not work until we have seen that doctor recovered. And I mean, I don't understand. It's been extended to nurses. Now, on Monday this week, a nurse on her way back from work in Calabar was actually kidnapped. And the kidnappers are asking for 15 million naira ransom. So I think something needs to be done to safeguard. There should be some security system or something for the medical personnel in Calabar. If I've had reports of like 5, 6 medical doctors and now a nurse, those are the ones I know about. How about the ones I don't have the statistics for? So I think the NMA should equally, at this conference, talk about security for their personnel, because we need the doctors to be alive so that they could
we need all health professionals to be alive.
We all need everybody. And just to also add to that, I think there's this erroneous assumption that doctors are rich or healthcare professionals are rich and all those sort of. And, you know, for me, I think there's actually been a decline. I think maybe now